If you're over 65 and starting your day with an herbal tea, popping a natural supplement, or adding a plant-based remedy to your routine, you might think you're giving your body a boost. Herbs are natural, so they're safe, right? Not so fast. For seniors in the US, where 80% of adults over 65 take at least 2 prescription medications daily, according to the CDC, the wrong herb can turn a health kick into a health crisis. Aging changes how your body handles substances. Liver and kidney function slow, metabolism shifts, and those pills you take for blood pressure, cholesterol, or diabetes can interact dangerously with certain herbs. Some can cause internal bleeding, heart rhythm issues, or render your medications useless. But don't toss out your tea just yet. There are herbs that can safely support your brain, heart, and energy, backed by science and trusted for centuries. Before we dive into the 3 herbs seniors should steer clear of, and the 3 that can help you thrive, let's get real. Aging in America means navigating a healthcare system where polypharmacy, taking multiple medications, is the norm. By 65, your body's not as quick to clear toxins, and conditions like hypertension, diabetes, or arthritis are common. The National Council on Aging reports that 94% of U.S. seniors have at least one chronic condition. Herbs can either be a gentle ally or a hidden threat, especially when paired with your daily meds. The wrong choice could land you in the ER. The right one could keep you sharp for that pickleball game or family barbecue. If this guide hits home, drop a 1 in the comments. If it misses the mark, a 0 will help me improve. Let's uncover the herbs that could harm you, and the ones that could help you shine in your golden years. 3 herbs seniors should never touch. 1. Licorice root, the sweet trap that threatens your heart. Licorice root is everywhere in the U.S., in black licorice candies, herbal teas, cough drops, and supplements marketed for digestion or stress relief. It's got a cozy, nostalgic vibe, but for seniors, it's a heart health nightmare. Its active compound, glycyrrhizin, acts like aldosterone, a hormone that regulates sodium and potassium. In younger bodies, this might cause mild puffiness, but after 65, when kidney function declines, affecting 60% of U.S. seniors per the National Kidney Foundation, licorice can trigger serious issues. It causes water retention, sodium buildup, and potassium loss, leading to high blood pressure, irregular heart rhythms, or even heart failure. The FDA warns that eating just 2 ounces of black licorice daily for 2 weeks can cause arrhythmias in adults over 60, potentially sending you to the hospital. For the 50 million U.S. seniors with hypertension, American Heart Association data, licorice is especially dangerous. It can interact with common medications like diuretics, e.g. Lasix, beta blockers, e.g. metoprolol, or AC inhibitors, e.g. lisinopril, amplifying or canceling their effects. A 2018 study in the American Journal of Cardiology found that licorice-induced hypertension increased cardiovascular events by 28% in older adults. Symptoms like swelling, dizziness, or a racing heart can sneak up without warning, and severe cases may lead to stroke or heart attack. Seniors on blood thinners like warfarin, used by over 2 million Americans, face added risks, as licorice can increase bleeding. Even small amounts in teas or supplements can build up over time, especially if you're sipping daily at your morning coffee shop or taking a digestive aid. Check labels for glycyrrhiza, licorice's scientific name, in candies, teas, or supplements sold at Walgreens or CVS. If you're tempted by licorice for a sore throat or upset stomach, rethink it. Your heart and kidneys will thank you for passing it by. 2. Fenugreek, the blood sugar saboteur. Fenugreek is a darling of health food stores, found in diabetes supplements, digestive teas, and even men's vitality. Blends at places like GNC. Praised in traditional medicine for lowering blood sugar and soothing digestion, it sounds like a win for the 29 million U.S. seniors with diabetes or prediabetes, CDC data. But for those over 65, fenugreek's unpredictability makes it a risky bet. Its blood sugar lowering effects can be too strong, especially when paired with medications like metformin or insulin, leading to hypoglycemia, low blood sugar that causes shakiness, confusion, fainting, or, in rare cases, coma. A 2020 study in Diabetes Spectrum found that fenugreek increased hypoglycemia risk by 22% in seniors on diabetes meds. Its potency varies wildly depending on the brand or form, capsule, tea, or powder, making it hard to dose safely. For an aging body, where blood sugar regulation is already tricky, this can spell trouble. Fenugreek also irritates the digestive system, causing bloating, gas, or diarrhea, symptoms that hit harder when your gut's not as resilient. Over 30% of U.S. seniors report digestive issues, per the National Institute on Aging, and fenugreek can make things worse. Then there's the hormone angle. Fenugreek's estrogen-like compounds can disrupt balance in seniors with hormone-sensitive conditions, like breast or prostate cancer, which affect over 1.5 million older Americans annually. It can also stress kidneys, already working overtime in 60% of seniors, and impair nutrient absorption, risking deficiencies. If you're on blood thinners, common for the 3 million U.S. seniors with atrial fibrillation, fenugreek's coumarin-like compounds raise bleeding risks, especially before surgeries or dental work. Skip the fenugreek supplements lining the shelves at Whole Foods. Your body deserves better. 3. St. John's wort, the mood booster that wrecks your meds. St. John's wort is marketed as nature's Prozac, available in capsules, teas, and tinctures at every Walmart or Amazon storefront. It's tempting for the 15% of U.S. seniors with depression or anxiety, National Alliance on Mental Illness data, promising a natural lift for mood or sleep. But this herb is a biochemical wrecking ball for seniors. It revs up liver enzymes, CYP3A4, which metabolize over half of all prescription drugs, including statins, antidepressants, anticoagulants, and blood pressure meds. In seniors, whose liver function is slowing, affecting 70% of those over 65 per the American Liver Foundation. This creates chaos, slashing drug effectiveness by up to 50%, according to a 2021 study in Journal of Clinical Pharmacology. Picture this. Your cholesterol-lowering statin, like Lipitor, taken by 40% of U.S. seniors, stops working because St. John's wort flushed it out, or your blood pressure meds fail, spiking readings and risking stroke. For the 80% of seniors on multiple prescriptions, this herb can lead to uncontrolled depression, blood clots, or heart issues. Symptoms like fatigue, confusion, or worsening mood might creep in so slowly you don't suspect the herb. Even over-the-counter drugs like ibuprofen or allergy meds can be affected, turning your daily routine into a gamble. Seniors with early dementia or Parkinson's, conditions affecting 6 million U.S. seniors, are especially vulnerable, as St. John's wort can disrupt brain chemistry. Its photosensitivity side effect also increases sunburn risk, a concern for older adults with thinner skin spending time at the beach or golf course. Before you grab St. John's wort for a mood lift, talk to your doctor. With America's complex healthcare system, you can't afford to roll the dice. 3 herbs seniors should choose. Instead, 1. Ginkgo biloba, the brain's trusted friend. Ginkgo biloba, from an ancient tree species, is a gentle powerhouse for the aging mind. It boosts blood flow to the brain, delivering oxygen and nutrients to keep your neurons sharp. 2022 study in neurology found that ginkgo, 120, 240 mmHg daily, improved memory, attention, and mood in seniors by 18% over 6 months. For the 1 in 9 U.S. seniors with early Alzheimer's or vascular dementia, Alzheimer's Association data, ginkgo may slow cognitive decline, helping you stay engaged at book club or remember your grandkids' soccer schedules. Ginkgo's antioxidants fight free radicals, protecting brain cells from age-related damage. It also supports heart health by improving circulation, reducing clot risk, and easing dizziness or vertigo. Common complaints for 25% of seniors, per the National Institute on Aging. For those with age-related macular degeneration, affecting 11 million Americans, Ginkgo may protect vision by boosting retinal blood flow. Taken as capsules, teas, or tinctures, ginkgo works gradually, offering subtle gains over weeks. Consult your doctor if you're on blood thinners, as ginkgo may slightly increase bleeding risk. Available at stores like Target or Costco, a standardized extract, 24% flavone glycosides, is best. For seniors wanting to stay sharp for bridge games or family stories, ginkgo is a reliable ally. 2. Ashwagandha, the stress buster for mind and body. Ashwagandha, an adaptogen rooted in 3,000 years of Ayurvedic tradition, is like a deep breath for the aging soul. It lowers cortisol, the stress hormone, which fuels anxiety, poor sleep, and fatigue in seniors. A 2023 study in Journal of Geriatric Psychiatry showed that ashwagandha, 600 mg daily, reduced cortisol by 22%, improving sleep, focus, and mood in adults over 65. With 30% of U.S. seniors reporting sleep issues, CDC data, this herb is a lifeline for those tossing and turning. Ashwagandha also supports thyroid function, which slows in 20% of seniors, boosting energy and metabolism. It reduces joint inflammation and aids muscle recovery, helping you keep up with walks in the park or gardening. For the 15% of seniors with anxiety, it offers calm without the grogginess of sedatives. Benefits build over 8-12 weeks. Typical dose, 300-600 mg of standardized root extract. Available at Sprouts or online, ashwagandha comes in capsules, powders, or teas. Avoid it if you have hyperthyroidism or take thyroid meds without a doctor's okay. For seniors juggling Medicare appointments or family stress, ashwagandha is a steady hand. 3. Lemon balm, the calming comfort for restless days. Lemon balm, with its soothing citrus scent, is like a warm cup of tea for the soul. It calms the nervous system without sedation, perfect for the 25% of U.S. seniors with anxiety or sleep issues. National Institute of Mental Health data. A 2024 study in phytomedicine found that lemon balm, 500 mg daily, improved sleep quality by 28% and reduced anxiety in older adults. Its rosmarinic acid boosts GABA activity in the brain, promoting relaxation and mood balance. For seniors with digestive complaints, affecting 30% of those over 65, lemon balm eases bloating, gas, or cramping. It's also a boon for the 6 million seniors with mild cognitive impairment, improving memory and attention by 12% after 12 weeks, per clinical trials. As a tea, it's a comforting ritual, especially for those feeling isolated, a concern for 1 in 4 U.S. seniors. Sold at Kroger, or as loose-leaf tea online, lemon balm is safe for most, 300-600 mg or 1 to 2 cups of tea daily. Check with your doctor if you're on sedatives, as it may enhance their effects. For restless nights or lonely days, lemon balm is a gentle embrace. Aging smart. Choices that keep you thriving. In the U.S., where seniors spend $30 billion annually on supplements, AARP data, it's easy to fall for natural hype. But herbs like licorice root, fenugreek, and St. John's wort can derail your health, from spiking your blood pressure to clashing with your meds. Instead, ginkgo biloba, ashwagandha, and lemon balm offer science-backed support for your brain, heart, and peace of mind. Aging isn't about chasing miracles, it's about smart choices. Read labels at CVS or Amazon, talk to your doctor, and trust your gut. With 54 million seniors in the U.S., let's share wisdom for vibrant living. What's one takeaway you'll apply to your life? Drop it in the comments and let's inspire each other. If this guide helped, leave a 1. If you've got feedback, a 0 will make it better. Here's to thriving in your golden years.